Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Gargi Rawat. Today, the focus of the show is going to be on the deadly dengue fever that's sweeping western Uttar Pradesh, with over 100 people having died, a majority of them children. Heartbreaking scenes have been witnessed outside the main government hospital. In fact, in front of our team yesterday, 3 children died. Desperate parents are arriving with children in their arms. And it's not just in Uttar Pradesh. There's been a spike in dengue cases in Bihar, in Delhi, in Kolkata, and even in Bengaluru. In Kolkata, though it's not dengue cases, it's a rising cases of fever in children. Now, the Ministry of Health and Family Welfare, the Secretary Rajesh Bhushan, has written to states and union territories for prevention and control of vector-borne diseases. The ICMR has said that the bulk of deaths in Mathura, Agra and Firozabad in Uttar Pradesh was caused by dengue fever caused by the D2 strain, which can cause deadly hemorrhaging. Well, to talk more about the situation, we're joined by Dr. Rajesh Malhotra, Chief COVID Facility Trauma Center, AIMS, and Dr. Vishal Rao, Member COVID Task Force in Karnataka. And Dr. Malhotra, I'd like to start with you. If you know this situation that we're seeing in Uttar Pradesh, the scenes are just heartbreaking. And how are we seeing such a crisis over there?
So it's actually, we have had the monsoon, which has been rather copious this time, and with this, I think this what has given rise to the increase in the vector-borne diseases, and so we are seeing a surge in the cases of dengue. And the problem about dengue is that if you get a repeat infection, then the previous antibodies which are already existing to the dengue, they cause severe reaction, and the outcomes are very adverse and the risks are multiplied. Apart from the fact that this D2 strain is also known to cause a lot of hemorrhagic fever. So I think we have to somehow attack at the root of the problem and control the vectors, because this dengue and chikungunya, on the other hand, the malaria, all these fevers are spread by the mosquito. So I think the vector control remains the key intervention, because this is indeed a serious problem at present.
Doctor, why, what is this D2 strain? If you could just explain to us, why this is a more severe form of dengue we're seeing, and it's being called hemorrhagic dengue, and especially children are being affected.
So the clinical picture with dengue can be decided by how it causes a fall in the platelet count and causes what is called as the capillary leak. So what it does is if the hemoglobin increases very much, it means the person is leaking fluid somewhere, and that gives rise to a dangerous situation where you get a shock and a fall in blood pressure. On the other hand, if your platelets fall, and these strain which causes a rapid fall in the platelets and then causes bleeding, can cause the hemoglobin to fall, and that actually again causes the shock and the lowered blood pressure and death. So an increase in hemoglobin or a reduction in hemoglobin, both are sinister in this. So by and large, it is the variety which causes a rapid deterioration in the platelet count, rapid fall in platelet count, and gives rise to the effects like plasma leak and hemorrhage, and thus causing these very adverse effects. So it's just like we had a Delta strain of COVID. It's actually much more virulent strain which attacks or causes the rapid fall in the platelets and gives rise to all these problems.
All right, Dr. Vishal Rao, if you could tell us what you're seeing there in Karnataka. We believe there has been an increase in the number of dengue cases there as well.
I think from what we hear from our experts, physicians and infectious disease specialists, during this season, especially during rainfall, when there are clogged drain systems, and during this COVID pandemic, we saw a lot of construction work, a lot of things hauled up. So we see a lot amount of clogging that is happening, which is an ideal breeding ground, like the previous speaker emphasized. I think that leads to a bigger menace of vector-borne diseases. We are again going back years back to dealing with communicable diseases, which is becoming a bigger problem. And I think this rise is going to be seen most likely with both flu and dengue rising, with various hospitals across Karnataka reporting a rise in both of these patterns of flu and dengue over the last couple of weeks to months. I think that's going to be a concerning trend because construction works, clogged sites, water bodies are ideal breeding grounds for these mosquitoes and vector-borne diseases. And so both of these, I think flu and dengue are going to be something we have to watch out for. And what's concerning is a lot of the times, even if you see today, Karnataka has been doing almost about a lakh 20 COVID cases. A lot of them get confused to assuming that it could be COVID, and there is going to be this false alarm and panic that, oh, this could be this. We keep hearing of cases of either children or adults coming back with a cold or cough, and then they're saying, oh, let's get a PCR done. I think eventually the other thought is that with the dengue vaccines also around the corner, hopefully there's a lot of discussion around this. Already they have sent the proposal to Government of India to reevaluate whether that's something eligible in the coming days in endemic regions. Of course, there are a lot of hurdles at the current point that it has to be previously given in a person who's previously infected. But I think at this juncture, it's time that we start talking about these solutions when we see some things like the UP scenario at the current point.
No, absolutely. And this is something, year on year, we see dengue infections breaking out. In Delhi, it used to be a massive crisis a few years ago. There has been somewhat better management, but of course, a prolonged monsoon complicates the matter. And also, Dr. Rao, the fact that we're still dealing with the pandemic, as you pointed out, also complicates matters, isn't it?
It further complicates the matter and gives you a wrong direction. I'm just giving my own example. I've taken a flu shot. They asked me, what's the science behind it? Does it protect you against COVID? I said, no, but it at least tells you and prevents you against flu as per the recommendation. So the point here is a lot of the times, just with a common cold or a cough, you would otherwise rush to assume that it is COVID and then you hit the panic button. So today, a lot of physicians and pediatricians are advising you to take your annual flu shots just to kind of overcome the unnecessary panic button that you assume with COVID pandemic around the corner. And that's what my physicians advised me to.
All right. Dr. Malhotra, coming back to the situation in Uttar Pradesh, if you could also tell us what is the situation in Delhi? We are seeing an increase in the dengue cases here as well. And what is it that parents should watch out for in children? And this situation, this crisis in UP, is it because a lot of the parents are getting their children at that very last stage, at that last moment to the hospital facility?
Yeah, that's absolutely right. Fortunately, we have a test for dengue which can test positive on day one. So, this is an advantage compared to many other illnesses where you may not be able to catch the infection on day one. And that is why, once you have fever and then, that like we know that in Delhi, the number of dengue cases have been increasing. So we have been getting a rise in the cases. But in Delhi, I think the awareness and the availability of investigation and all make it possible for people to come with the diagnosis. Now, then the onus is on the parents and the physician to make sure that the things never get out of hand. We know that, in dengue, you give only paracetamol, don't give ibuprofen or any other medicine because that can cause fall in the platelets or interfere with the function of platelets and aggravate the bleeding. So that's first thing. So the parents have to know that you have to take timely advice from the doctor not to give any other medicine other than paracetamol for fever. And then, any time from 3rd to 7th day, the platelets can fall and we know that then it can cause hemorrhage. So it is very much in order, to get initially a daily blood test done for, hemogram to look at the platelets and the hemoglobin and what we call as the PCV or the hematocrit. And if you see a fall, then every 12 hours you have to test. And if you see a precipitous fall, maybe every 6 hours if the platelets have started going below 30,000 or 25,000, because then you have to be ready to give them the necessary treatment. The hydration has to be very good. So like you said that many times it's treated as a normal fever and the patient is kept at home, the child is treated at home till the time it's very late. So the key is to get to the medical attention right in time to avoid complication. The things really get out of hand.
All right. And Dr. Vishal Rao, for viewers, if you could just tell us, how does one tell the difference? How does one know, besides the test, of course? And one can imagine, doctors, that what we're seeing in Uttar Pradesh is because perhaps of the lack of these facilities, as you said, testing every day, testing from day one. And that is something that needs to be strengthened there. But Dr. Rao, if you could tell viewers, how does one tell the diseases apart?
I think Dr. Malhotra rightly pointed out that the key aspect in this is early diagnosis and not to wait and self-medicate. I think that's going to be a very, very key point to differentiate. The earlier you intervene, the better the chances of you having a successful intervention. I think that cannot be re-emphasized. The early diagnosis and right planning of the interventions would be the only way we could actually pick up these early. But other aspect is going to be about hygiene. And I think this is a crucial aspect to prevent water stagnations, to be watchful in your house vicinity on hygiene and cleanliness is going to be a very, very key aspect to preventing these. So even in the rural areas, you're now, using of mosquito nets, coils, preventing water stagnations. I think a lot of emphasis needs to be done on preventive aspects. And I think a lot of the time we emphasis here on health in all policy approach. So health is not just the responsibility of a health department alone, but here you can see that municipalities or local gram panchayats can play a very pivotal role to ensure that through their committees, through their hygiene groups, they can actually raise awareness on such kind of measures, especially in such endemic scenarios like what we are seeing in UP.
All right. Well, thank you so much, doctors, for joining us. And it's absolutely, just heartbreaking seeing what's happening in Uttar Pradesh currently. It's been a month, over 100 people have died, and most of them have been children. Now on the show, a look at vaccination of children in the United Kingdom. All 12 to 15-year-olds in England will be offered a COVID vaccine after the top medical advisors said that the children would benefit from reduced disruption to their education. The British government confirmed that the offer would be extended to all children aged 12 to 15 after unanimous recommendation by the chief medical officers from the 4 nations of the UK. Rollout in England will begin next week. The children will be offered the Pfizer vaccine. Vulnerable children in the age bracket were already eligible for the shots. Now in the US, Israel and some European countries, they've already rolled out vaccinations for children more broadly, putting pressure on the British government to also follow suit. Well, to talk more about this, we're joined by Dr. Rajesh Bhushan, Director, Global Health Alliance, UK. Thank you so much, Doctor, for joining us again. And if you could give us more details of this program, it's going to be rolled out from next week in England.
Yeah, thank you, Gargi, for having me on the show. As you said, that the JCVI initially wanted to wait and watch to see what the side effects were, because as you know that in America, there were children who were getting some myocarditis, inflammation of the heart muscle, and that was the concern in the UK as well. But now the JCVI and obviously the group of experts in the UK, including the pediatric group experts, they have all looked into the side effects of the vaccine, and obviously they have done their own trial on about 2,000 children between the age of 12 and 15, and they found that the side effects were almost negligible. And it obviously, the benefit outweighs the risk, especially with the schools opening this week. It is important that we try and vaccinate our children and keep them as safe as possible, because again, we know that some children do get it, although majority of the children will still get only the mild version of COVID. As we know, globally, that has been the case. But again, it is important to try and protect most of them as much as possible.
If you could tell us more about, these cases of myocarditis that are being reported, if you could explain what is it? It's concerning the heart. Also, it's being seen more in boys than in girls, and it's also very, very rare, isn't it?
It's absolutely very, very rare. So that is what I would like to assure, that the numbers were extremely negligible. It was about 5 to 10 per million in America. So what happened that in America, that they found that when they were giving the Pfizer vaccine, especially after the second dose, there was inflammation of the muscles of the heart. So again, myocarditis is a situation where the muscles around your heart gets inflamed and causes infection, and that is what the myocarditis is. But again, the numbers were very, very small. Majority of them, they still made a good recovery from the myocarditis. So again, nothing to worry about, but some people can have some long-term complications like heart rhythm problems or heart failure, or other complications can happen. But the numbers are extremely, extremely rare, so I would not worry at all.
And that's why you've decided on just one jab for children between 12 to 15?
To start with, yes. So that is what the government is trying to roll out today. The Prime Minister is likely to announce this afternoon that we'll start with one jab to start with. Obviously, as I said, that is an ongoing research. People will have to look at more evidence. But the committee, as for now, the chief medical officers of the 4 nations are now in agreement that we should start vaccinating our children soon.
All right, and what are the worries around it? I mean, about in the population, among parents, has there been a lot of have people been wanting the vaccinations for children, or has there been a lot of suspicion around it?
So most of the countries in Europe have started vaccinating their children, and that was the concern in the UK because again the parents here were very keen. Especially the schools have opened up this week, and obviously with the schools opening, the chance of infection spreading goes up. We know that we are almost getting about 35 to 40,000 positive cases every day still in the UK, although the number of admissions and deaths are extremely low compared to the previous waves of COVID. But again, it is, as I said, that it's important to make sure that they completely protect our children, and that is why there are some concerns raised from the parents group and the school children groups that we should try and vaccinate our children and come up with the data. And that is what the UK JCVI and the expert group has come out. They're saying that yes, we can go ahead and start vaccinating the children.
But there's not a vaccine mandate. It's not necessary or mandatory for children to get the vaccine before they go back to school.
No, it's not mandatory. So again, they are being just offered. So again, it is for people who really want their kids to be vaccinated, because again, well, like most of the treatment, you have to offer to the individual, and it's up to the individual decision whether they want the vaccine, whether they want the medicine. So again, it is being rolled out as an offer for children between 12 and 15, and people who want to take it can take it. It's not mandatory.
All right, and they have to get the go-ahead from their parents to actually get the vaccine.
Correct.
All right,
yes,
and as you said, in Europe, we're already seeing a lot of countries are vaccinating children, because here in India also we haven't started. So we're watching all this very closely, and hopefully in a month or two we should also get vaccines for children. And in the UK, they've looked at all these experiences, especially in the US and in Canada, where they started earlier on.
Correct. So most of the countries in Europe where they have started vaccinating, and the good news is that most of them have been safe. There have not been big reports of any myocarditis or inflammation or side effects from the vaccine. So I would like to reassure people who are trying to get their children vaccinated in India that do go ahead and get your children vaccinated when the government starts it, because again, as I said, that the government in the UK has now done its independent research on about 2,000 children between 12 to 15 recently, and majority of the data is very, very reassuring.
And why is it that only the Pfizer vaccine will be given and not the AstraZeneca, because that's the one that's available here in India?
So the research is on the Pfizer vaccine and the Moderna. So again, the government has looked into both the Pfizer and the Moderna. We are still again doing more research on the AstraZeneca. So I think hopefully in the coming weeks we'll have some more data on the AstraZeneca as well.
All right, and doctor, about COVID infection in children, there's been talk about how children don't get very severely affected by COVID, but now there's also information that children do suffer long COVID, that's also being seen in children who do get coronavirus. What do we know about that?
So again, that study again came out from the UK, but that was looking mainly in people and children who were immunocompromised, who are pre-existing medical problems. So healthy children did not suffer long COVID. Majority of them were saved. Majority of them, they just came out as a normal flu, like that would have just mild sneezing, cough, cold, fever, and come out in a few days' time. But there were some cases in immunocompromised children in the UK who had some long-term COVID symptoms. But I'm sure these are not very life-threatening. They're not going to cause any major long-term complications. These are again problems which make you feel slightly tired, slightly weak for the foreseeable future, maybe a few months. But majority of them are coming out of those problems. So I would not worry about it.
And in the UK, what is if you could just share with us the experience so far after the restrictions have been lifted. Now the next stage is going to be the reopening of schools, and the majority of your population has been vaccinated, at least the adult population.
Yeah, so we have vaccinated more than 90% of our population with the first dose, more than 80% with the second dose, which is a big achievement. Although we cannot compare UK and India because the size of the country is hugely different.
Yes.
But the good news is that we have opened up the schools, and the numbers have still remained around 30,000. The positive cases have not gone up. As I said, the number of admissions and number of deaths are also very, very low compared to the previous waves. And this is again only because of the vaccination, the excellent vaccination work that the UK government has done. Is responsible for less hospitalization and deaths, and that is why life is almost back to normal in the UK. There is no restriction, there is no face mask mandatory rules anywhere in the country. So again, it is very, very reassuring that the government has done an excellent work when it comes to vaccination and protecting the people of UK.
And now some concerns going into the winter months. Finally, if you could tell us a bit about that.
So winter is always a concern because again, we get lots of flu in winter. And the advice is that we are going to roll out our flu jabs as well. And there's a possibility that when we roll out our booster dose, we'll have the flu and booster dose together. So that is the plan that the government is looking into, and we'll have some more information in the next couple of weeks. And as I said, that the flu is always a bad season for the NHS because again, especially people who are immunocompromised are likely to get more flu. And that is why we are trying to get our flu jabs out very soon. So hopefully the booster and the flu will be given to immunocompromised and healthcare workers to start with.
All right. Thank you so much, Dr. Narayan, for speaking to us here on the program.
Thank you.